I'm Kelsey Mora. I'm the Chief Clinical Officer of Pickles Group. I am a dual certified child life specialist and licensed clinical professional counselor. And I'm going to talk briefly about how to talk to kids about breast cancer. We have more content on our YouTube channel and in other formats. So you will hear about that and receive those links as well as a follow-up email. But I'm going to keep my portion of tonight brief so that you can hear from our incredible parents and panelists. And I'd like to just honor why we're all here in honor of Breast Cancer Awareness Month. Certainly 1 month is not enough. So I know everyone who's here is thinking about and navigating breast cancer all days of the year, but wanted to come together and really just take time and space to talk specifically about how to talk to kids about breast cancer. At Pickles Group, we actually serve almost 50% of the youth in our programs have a parent with breast cancer. So it is a very high number. And so we just want to really make space for families. I am joined in collaboration with the Ohio State University James Comprehensive Cancer Center. Lauren Demoulin is going to be doing our panel, moderating our panel, and she also manages their Parenting Through Cancer program. We have the Male Breast Cancer Global Alliance here. As a reminder, while there is a lot of pink and a lot of talks of women during Breast Cancer Awareness Month, we do know that breast cancer also affects men and males, and so we want to make space for that. We have Keep a Breast here, and we have Sharsheret here, and you're going to get a chance to hear about their organizations at the end, so please stay with us. All right, so a little bit about Pickles Group before I dive into how to talk to kids about breast cancer is just a little bit about our mission. And our mission is really supporting the kids who have a parent with cancer. All of our programming is free. It's intended for kids supporting kids. And we are really focused on 3 main pillars of our support. So that's honest and age-appropriate information. We want to help parents feel better prepared to talk to their kids. We also train clinicians on feeling better prepared to support parents who are asking, what do I tell my kids? We also focus on coping skills and then helping peers connect with one another. In terms of what we're going to cover tonight, I will talk a little bit about different developmental responses to having a parent with cancer. We'll take a closer look at our Family Cancer Support Kit, which is where we really hone in on 3 main tips for talking with kids about cancer. And then we'll turn it over to our family panel and discussion and end with hearing a bit more about our partner orgs, resources, and health centers. So in terms of developmental responses, I always start with infancy because I recognize that families here may have kids in all different stages of development. That being said, our youth programming at Pickles Group is really focused on 1st through 12th grade, but we have kiddos who join us, in kindergarten and then kind of opt into different programs, and we have families who really span the lifespan. So in terms of infancy, of course, there is limited understanding. A lot of people feel like they're never going to remember, they're never going to understand, and of course, there is some truth to that, but even the youngest kids definitely sense changes in their environment. They're aware of the behaviors in their environment. And when it comes to breast cancer, this can be a really big one with little ones who are not quite understanding why their parent can't hold them for a while, can't drive, can't feed them. There's a lot of changes that disrupt their caregiving. And so we want to really focus on what we can do to help the littlest ones with some simple language about what's happening with their parent. Preschoolers start to have more understanding, but they often relate it to what's familiar to them. So this is when it becomes helpful to talk about cancer as its own illness, and often we talk about it as a problem with the cells, because kids, if they just hear sick or illness, they might think about germs or colds. They might think about, runny noses and coughs at school and think that it's going to get better quickly or that it's going to, be contagious. And so this is the age where we actually want to distinguish that cancer is something different than maybe what they're used to. Elementary age, of course, they start to have more understanding, but they also might have misinformation. We really want to help school agers know that they can learn from their most trusted adults. And you're going to hear from our panelists who've navigated this with a lot of different ages and stages and probably have some really personal insight into what that's like. But if kids don't feel like they can ask their questions or talk to their trusted adults, they might look for information from their friends or maybe even from the internet. And we want them to know that it's an okay topic and that you can find things out together. And then lastly, teenagers. I saw there's a lot of families registered tonight who might be navigating cancer with teenagers. And teenagers can feel tricky because they definitely understand more, but they might be thinking about really big picture stuff. They might have really big abstract questions or concerns. They might be struggling with their role. How do I prioritize my friends and my school and my hobbies, but also be supportive of my parent, my family? So they can be a group of an age range where we do have to really lean into what's on their mind, what they're concerned about, and try to create some support around that. So for those of you who haven't seen it, Pickles Group has a free family cancer support kit. On the screen, you see our English version, but it's also available in Spanish. This is a completely free resource. You will receive information about it tonight. Whether you're a clinician, it's something you can hand out to your patients, or if you're a parent, you can actually request it yourself. We have a digital copy and a print copy. So this is kind of that first step where it's something that a clinician can hand to a parent who's recently diagnosed with breast cancer and asking, where do I begin? But the tips inside here are really meant for the full cancer experience. So conversations that occur throughout a cancer experience and treatment, and not only that initial diagnosis conversation. So the 3 guiding tips that we use at Pickles Group for talking to kids and teens about cancer are these: share information, share expectations, and share feelings. And what I want you to walk away with is that these 3 tips can really be applicable to any difficult conversation in the context of cancer. So the first tip, share information, is really about sharing an age-appropriate version of the truth. So when it comes to breast cancer, there might be a lot of things to explain. The first thing might be talking even just about body parts and the breasts. Maybe it's an early stage situation and we're talking about tumors or biopsies or removals or mastectomies, lumpectomies. There's a lot of words that kids may not understand. Radiation, drains. You see on the screen a picture of a little bit of medical play that I did with a family where we actually created what a mastectomy would look like on a doll. And so it doesn't have to be fancy. It doesn't have to be elaborate. This is really pipe cleaners and stickers and Band-Aids and gauze. So, but it helps kids know, oh, my parents coming home with some accessories, some bandages, things are going to look different. And that's why they can't hold me, or that's why they can't drive for a while. So we do want to help parents use bite-sized information. And so as a parent, it might feel really overwhelming when you're getting a diagnosis, you're scheduling a surgery, you're planning, and waiting for treatment plans. And so you might not know where to begin with your kids. And so we really recommend starting with what they need to know right now. So really kind of slowing down, okay, what's happening right now? What are they going to experience? Well, a parent is in the hospital. Okay, let's talk about who's going to take care of them while you're away. What are you going to look like when you come home? What's going to be different? And then really build on those conversations along the way. So kids will kind of self-dose how much they can handle at any given time. And so we can really follow their lead and respond to their questions and their concerns. I always say the goal of sharing information with kids is really about opening the lines of communication and building trust. So that's really true, whether it's a 2-year-old, a 12-year-old, or an 18-year-old, is really helping them know that this is an okay thing to talk about and it's affecting our whole family. And just because you're talking about it doesn't mean you're going to be talking about it all the time. You can still have normal moments within the difficult conversations, but it helps them know that they're going to be updated when there's a change or when there's an update. And it also gives them permission to ask their questions when they need to. So with breast cancer, something else that can look different is considering the frequency of conversations and the cadence. And so you're going to hear from parents on the panel who have navigated breast cancer for different amounts of time. We know that metastatic breast cancer can be a really long experience that you can live really long and really well with, but there's going to be ups and downs along the way. And sometimes a parent may not look sick to a kid. And so helping kids understand the cancer at different stages of treatment and situations. So it's really not a one and done conversation. We really want to help share information, know that we can talk about it, and keep building on those conversations as new information comes. In terms of sharing expectations, there's a lot of changes that can come with having a parent with breast cancer, and certainly depending on kind of who might be a primary caregiver, what the family structure or system looks like, it may come with more changes than others. And so helping kids know what's going to be different. But I think that we worry that everything's going to be different. And it can also be helpful for kids to know that some things will be the same. So it might be something like, you're still going to go to school, but I can't drive you right now. So grandpa's going to take you, or the neighbor's going to take you. And when we're having open conversations with kids, it can also help with the unexpected. So if there's an unexpected hospitalization or an unexpected side effect, we can talk about, remember, I'm getting that really strong medicine. It's making me feel icky sometimes. Or the doctors have to be extra careful with my body and germs. And so since I'm not feeling well, I need to have a checkup and go to the hospital. So it helps you talk about the unexpected because you're already talking about the overarching theme. Providing choices can be really helpful for giving kids a sense of control, helping kids, with how involved they want to be. So if it's a treatment plan that involves, maybe weekly or daily, radiation or chemo visits, some overnight stays, some clinic visits, helping kids know exactly what's happening, recognizing that it can change. We know that, we might think we're going to chemo and then something changes, but helping kids know a little bit about what to expect and predictability, but giving them a choice about how involved they want to be. Do they want to visit? Is that allowed? Do they want to make a picture for you? Do they want to help you pack your bag? And also doing it in a way that's comfortable for you and protects what you need and want. So maybe you don't want to have a kid at clinic with you, and that's an okay choice to make. But giving choices that you're comfortable with them picking. A lot of parents navigating breast cancer might talk about how to handle hair loss with their kids. And so there might be cold capping involved, or there might be a time when a parent is ready to shave their head because it's itchy and uncomfortable and they're having a hard time dealing with the hair loss. And I hear from a lot of parents the worry about, what my kids need or want. And so having some open conversations about that, and also feeling comfortable setting boundaries with, my head's feeling really uncomfortable and this is what mommy needs, or this is what I need, so that they can follow your lead and trust that you're taking care of you too, and that's an okay thing to choose. Keeping things consistent, can be tricky, but what I mean by that is continuing to find ways to parent through the typical growth and development. So I often hear, kids worry about bothering their parent with, homework questions, but then parents are like, I kind of really want to help with homework because it makes me feel normal, it makes me feel capable, right? And so navigating those kind of normal daily things in the context of cancer can be really helpful both for kids and parents. Also, when there's so much chaos and change, it can be easy to kind of get away from structure and routine, and maybe even rules sometimes, just because we kind of want everyone to be happy. But that can actually cause more stress, right? It can make it harder to parent and to discipline and all those things. So trying to maintain that as much as possible, and knowing that kids, job is to be a kid, it's to go to school, it's to play. And so continuing to do those things can help them feel like they have a source of purpose, stability, but it can come with extra support. Maybe they need to have a little bit of extra support at school, or maybe they need some additional accommodations right now, and that's okay. So keeping things as normal as possible, but recognizing that things aren't really normal, and how can we create a sense of predictability and stability within the context of everything that's changed. And then the last tip, so we've talked about sharing information, sharing expectations, and the last one is sharing feelings. I know I'm going through this quickly, but we do have a lot longer content available for you. And today is really about the parent panel and kind of hearing how different families have maybe applied some of these things, maybe made some mistakes, maybe done it their own way, because there's no exact right way. It's really what's best for each family. And I've had families ask me like, oh, we haven't talked about it yet. Are we too late? And no, you're on your own timeline. You can always tell kids, well, you're getting so much older now. I think you're ready for more information, and we're ready to have more conversations, because some kids may have been already born before a parent had cancer. Maybe they weren't. Maybe they were really young. And so trying to figure out the right timing can also look different in different situations. So sharing feelings, often parents might feel like they have to be strong for their kids, or they can't show their emotions. They can't see me cry. It can actually be really healthy and normalizing for kids to know that it's okay to have a range of emotions. And so this can be an opportunity to model for kids how to feel and how to express and how to deal with hard things, and both the good and uncomfortable. That it is okay to laugh and smile and play. And I might have a day where I really don't feel good and I'm kind of sad and tired, and need some space or a break. So the way to do that can be increasing communication. So modeling for them yourself, saying, I feel tired right now because of the strong medicine. I think I'm going to take a rest. Or I feel sad because I can't run with you as much as I want to. And I'm going to find a different way to, play this game, or something like that. So really communicating how you're feeling and why, and then kind of working together to find some sort of a solution. And there's not always solutions. So recognizing that kids also might just need support over solutions, and being able to say, I wish things were different. This is really hard. And trying to kind of just join around what's hard too, and not always feeling like we need to fix things. And lastly, of course, embracing feelings comes with practicing coping skills. You know, if we can identify how we feel, we can work together on what to do with those feelings. And so, um, as a parent, trying to find your own strategies and support systems so that you can model that for kids and help them know, you know, this is what works for me, but you're your own person and you can find your ways. And there's a lot of ways to cope, and your way might look different than mine. I might be someone who really likes breathing and meditation and nature, and you might be someone who wants to do jumping jacks or go running or play tag. And that's okay, right? There's a lot of different ways to get those feelings out and to cope. And so, really trying to, as a family, prioritize navigating hard things and recognizing that that's a really transferable skill. If kids can learn to how to cope and share feelings with hard things, it can really help them in their whole life. So we've talked about sharing information, sharing expectations, and sharing feelings. And I would love to turn it over to our panel because I think, you know, while I can go into a lot more detail with my professional brain, there's nothing more impactful and meaningful than hearing directly from parents who are navigating the daily wins and struggles and stress throughout a parent's cancer treatment. So I am going to turn it over to you, Lauren. Once again, Lauren's joining us from the James Comprehensive Cancer Center at Ohio State, and she manages their Parenting Through Cancer program. So Lauren, would love to hear a little bit more about you, and then have you work with our amazing panelists to introduce themselves.
Sure. Yeah. Thank you again for having me. So like Kelsey said, I am a social worker at OSU-the-James, and I manage the Parenting Through Cancer program. We also have other services that I'll go over later. But we are really aiming to meet the needs of families who have kids under 18. And I think there's just a lot of specific needs that you all are facing. So we're happy to have the parent panel on today to share some of their own insight and experiences. So with that, we can dive into it. As a reminder, we'll do some quick introductions. We'll just keep it short and sweet so we have enough time for all the other questions and all of your other input for those things. And then when we get to the other questions, panelists, just as a reminder, if you want to just unmute yourself and speak up on any given question, feel free. But if you have trouble, since this is virtual, feel free to use the raise your hand feature. So first, if we can just start with an introduction from each of you, a short little in a nutshell version of your experience. And also, if you don't mind sharing the ages of your kids when you were diagnosed, I think that would be helpful as well. So to start, Diana, would you start?
Hi, everyone. My name is Diana Keene. Most people call me Di. In 2014, I was diagnosed with inflammatory breast cancer, stage 4 de novo. My children at the time were 6 months old and almost 4. I'm happy to report that my youngest is about to turn 11, and I have a healthy high schooler. I am also an advocate for metastatic breast cancer. It is a journey that never ends, and the conversation with your family and your kids never ends because there's bumps along the road, and it's not very smooth all the time. But I'm also an advocate through a nonprofit called Roots and Wings Charitable Foundation, and we support integrative oncology appointments, much like how Pickles supports families. It's very important for people who are on whatever journey they are with breast cancer to make sure they have strong support. So that's me.
That's great. Thank you so much for sharing. Karen, do you want to go?
Sure. First of all, thank you, Kelsey, for having me on this panel. I'm excited to be here. My name is Karen Kalin. I am from the Los Angeles area, and I have 2 teenagers, ages 16 and 14. I was diagnosed just a year ago with stage 4 invasive ductal carcinoma. Since then, over the last year, I've gone through surgery, chemo, radiation. Now I'm on hormone blockers for the next 5 years, along with ovarian suppression injections. So I'll tell you that my journey has not been easy, as I'm sure many of you can relate to. But as difficult as the physical has been, the emotional has actually been even harder. I have been very grateful for finding Sharsheret, and they're an amazing social worker. She got me through some really difficult times. But I'm also happy to say that I'm doing really well. I'm actually running the New York City Marathon this Sunday as part of Team Sharsheret. And I am really excited to cross that finish line. To me, it's going to represent way more than just the finish line of my marathon training. So happy to be here.
That's amazing. Thank you for sharing. We'll be thinking about you on Sunday and rooting you on from where we all are. But that's great. And Marquita?
Hi, everyone. I'm Marquita Goodluck. I'm a 7-year breast cancer survivor and advocate. I'm also the Give Back Grant Program Manager for the Keep a Breast Foundation. I was diagnosed with stage 2 invasive ductal carcinoma breast cancer at the age of 35. At that time, I was a mother of 3 young children. My kids were the ages of 7, 9, and 12. I underwent 4 rounds of chemo, radiation, and a bilateral mastectomy with reconstruction. Inspired by the many challenges that my children faced on my journey, I decided to write a children's book titled BK's Mommy Has Breast Cancer. This book aims to empower children as they navigate their mother's breast cancer diagnosis. I'm very happy to be here. Thank you for having me.
Thank you. I think no one can inspire all of you more than your kids can, probably. So it's great to hear where you all are now. And Kara.
Hi, thank you so much for having me. My name is Kara Selsman. I live in the suburbs of Boston, and I am the mother of 2 sons who are now ages 28 and 25. My story is a little bit different. I don't want to say interesting because really not interesting, but my husband Mike was diagnosed with metastatic breast cancer in 2011 when my boys were 12 and 15. And then in 2013, I was diagnosed with, they never really staged it. At first, they just thought it was ductal carcinoma in situ. I had a lumpectomy and it was invasive. I had another lumpectomy radiation, and then I was on medication. I thankfully am fine. But in 2018, after a 6.5-year battle of chemos and surgery and hospital stays, my husband, Mike, passed from breast cancer. So I was in 2018, and my boys at the time, one was graduating high school, one was graduating college. They were 18 and 22. I thankfully have had clean bills of health. And I have, my husband and I, though he's a very private person, did a lot of work trying to build awareness to men that they are also able to get breast cancer. So, and that is how I met Sherry from the Male Breast Cancer Alliance. And we spoke to a lot of people. The boys came with me in 2012 when the governor of Massachusetts signed a proclamation declaring the 3rd week of October as Male Breast Cancer Awareness Week for our state. And every year in the 3rd week, I get that proclamation. So they got to see us try to encourage something positive from this situation as well. So again, thanks for having me.
Thank you, Kara. I think it takes a lot of humility on his part to put aside that stigma and say, no, we need to really raise awareness as a male, right? And it's amazing you guys can do that together too. Got that time to do that together. Thank you again for y'all being here. So diving into some of the content we've already reviewed today, really advocating for open communication with kids about cancer and having, of course, age-appropriate conversations with them about diagnosis, treatment, etc. So from your experiences, what do you guys feel like is the benefit of having these open communications or open conversations about cancer with your kids? Anyone that wants to start can speak up. Sure,
For
Kara.
me, I'm sorry. For me, I think that open communication eases a lot of anxiety and fear. Because one of the things I know with my children, every time I had an appointment, even if they didn't know where I were going, they just assumed that it was about breast cancer. So I find that when you're honest and you create an open, like, age appropriate dialogue, it eases a lot of fear and anxiety, and they know they can trust you. And also, you can prepare them for what may come ahead.
Thank you. Kara?
I think that as with adults, information is power. And I think that when you can talk to your kids about what's going on, obviously in an age appropriate manner, it gives them some control over what's going on. And obviously my boys, when Mike was diagnosed, were 12 and 15, and what they needed to hear was a little bit different. My older son had started Googling the minute we mentioned cancer, and we kind of had to get some control over that. And I think that if they knew they could come to us with their questions, with their concerns, they wouldn't just go to their friends to ask questions. They wouldn't go to Google and ask questions. And I think they got better information, and there was less fear involved in the whole situation.
Thank you for sharing that.
I was
Karen?
also gonna just chime in here. My kids actually were about the same ages as Kara's kids when I was diagnosed. And just because, they're teenagers, I always felt like it was important to be honest and really to try to answer their questions in full. And even when I didn't have the answers, I felt like it was just really important to try to be solution oriented. So it could be, yes, I have cancer, but this is what I'm going to do about it. I thought that was always really important. So, they knew what I was going through. I wasn't hiding any emotions. I was very emotional a lot of the time, and I think that was okay. And another thing is I really wanted our lives to be as normal as possible. So personally, I went through cold capping, and for me, it wasn't really about the vanity of losing my hair. It was about the normalcy factor. And I know that that was something that Kelsey talked about as well. But my kids are really involved in a lot of things, and I wanted to be able to go to my son's cross country meet, or I wanted to be able to go to a football game where my daughter was cheering, and I didn't want it to be about me. And I wanted my kids to be able to lead normal lives and not have it be about their sick mom. So so that was why the cold capping was important to me. I do know that's not always an option financially, but I will also plug Sharsheret here for a minute. And they do provide a lot of financial subsidies for cold capping.
Thanks for sharing, Karen.
Lauren, can I just mention something?
Mhm.
I think that 10 years ago, when I was diagnosed, there wasn't easy access to talking to your kids about cancer. And when you have an infant and a 3.5-year-old, there's no way you can separate yourself from being a mom and wanting to ease their journey into the fear and the sadness and the acceptance. And it took me as a while as a parent and a mom and my husband as a caregiver to really accept the situation that metastatic breast cancer was in our lives now, and it's not going away. And we didn't have any support at that time to help us navigate it. I mean, there's the internet, there's things to look up, but finding the tools to help you through when we first started working with an individual family cancer therapist and knowing how to speak to them and communicate with them at their age appropriate level was an absolute game changer for us. Not only did it make being a parent easier to talk about it and less protective, but also allowing the kids to be in the journey with you. So instead of it being what's happening to mom and how we can support and what you need to know, we kind of became more of a unit. And then when we were introduced to Pickles as a one of the first families over 3 years ago, it was another game changer because all of a sudden the programming gave us a whole new toolkit. And since then, metastatic breast cancer doesn't come without bumps along the way, And each time it just strengthens our bonds as a family unit versus it being more segmented as it felt like in the beginning. So I think that the benefits of being able to discuss with your kids in a way that is fluid and with the right tools is just absolutely, like I said before, a game changer. I don't know if we would have had such a successful journey to this point without it.
Thank you for sharing that. Yeah, it is great to know that there are more resources now than several years ago, and to use those resources to your advantage so that you guys feel more prepared when having these conversations or when prepping yourselves, both emotionally and just kind of thinking about what you might say, even if it's not the initial conversation, but just ongoing conversations, right? And I'm hearing from all of you pretty much involving your kids as sort of a theme, underlying theme here, right? Like instead of protecting them in the sense of shielding them from the information and keeping it a secret, instead, let's have an open conversation about it and involve them, whether it be my 3-year-old's going to bring me a glass of water or my teenager is sitting down and we're talking about questions that they have for the doctor. So to an age appropriate level, having them involved and in the sense, giving them a sense of control, because kids of all ages can benefit from different capacities of control when so much else feels out of control, right? So thank you for sharing all of that. What do you all feel like was the most challenging part of communicating with your kids about your experience, whether it be the initial conversation about diagnosis or about something else along the way?
I was going to say something before, but I'll start with this and then I'll answer your question. The one thing that I am going to say to people is when you're talking to your kids, be very careful what you're telling them versus what you might be telling maybe your friends, especially if they have kids, your kids' ages. When we found lesions on my husband's brain, I had told a friend of mine who I just assumed would not tell her 7th and 8th graders about this because we weren't sure what it was and we didn't want to tell the kids till we knew. And she turned around and her kids turned to my kids and said, "Oh, your dad has tumors on his brain." So that's just a little thing I just want to mention. You know, it's great to communicate. It's great to rely on people, but be really careful who you're saying things to. And even if they don't mean to say things, I didn't clarify, please don't say anything to your children because I just didn't think I needed to. But I just think that's kind of an important thing as we're trying to give our kids the information that they think that we think they need at that point. So I think that's probably the biggest lesson that I learned out of all of this. And now I've forgotten the question you asked, Lauren.
That's okay. I'll repeat it, but I will second what you're saying that, you know, some other friends or family that you might talk to, they're not doing these webinars with you. They're not getting this education about what to say and not say to kids or to other family members and thinking about who might say, you know, the telephone game, right? So it's very good to be cautious about that and kind of think that through and have private conversations and disclaimers about what to share and not share and just kind of to consider that. So that's a helpful tip. My question was just what was the most challenging thing for you all to communicate to your children and how did you handle it?
Okay, I'll shut up. I'll let Diana talk.
Oh, sorry, Kara, please answer if you'd like to.
No, I haven't stopped. I was going to say that was my most challenging situation, having to maneuver around that one. But I think how fluid the situation was the most challenging because with my husband, you know, he'd be on a medication until it didn't work. And we knew that from the beginning. This was how you live with metastatic breast cancer. You're on a medication until it stops working and then you're on the next thing. And just having to the whole process was fluid and having to sit down with them every few months and be like, all right, this didn't work. Now we're on to the next thing. And I think that, you know, it just left us all feeling very rough when we knew those scans were coming up. And I think that was probably the most challenging conversation. Those are the most challenging conversations.
Yeah. We'll go to Diana and then Marquita.
I just wanted to answer this question, but also address the BRCA question in the chat. So we do have a history of breast cancer in my family. So my kids have seen throughout the years, my mom, my aunt, my cousins, my grandparents, my grandmother go through breast cancer journeys and experiences. And unfortunately, we've lost a lot of them while my kids were growing up. That can be quite scary for children as they experience other family members go through what also their mother technically has. So I think one of the biggest challenges talking to them was about that we have genes that express breast cancer and about what that means for them and their health and what it will mean for them as they get older, especially now that my daughter is a high schooler, how she can stay on top of managing her own health and care, to rewrite her own story and not have the fear of what she's witnessed within our family. And that brings on a whole different topic of conversations of their own fear of illness and being there to understand your journey, but also it could potentially be theirs. The great thing that I can say is that they're doing more and more genetic testing and finding more and more genes. So as our children are growing and they have these fears and concerns, we can remind them that medicine is advancing and they can be caught earlier. And if they have the genes and that might possibly express breast cancer, they can find out sooner than they had in my grandparents' generation or my mother's or even mine. So I just wanted to touch on that because it has been a very difficult journey and it comes up quite often, especially with my teenager now, about her fears and what she needs to be doing. Again, having the foundation and the toolkits to know how to talk about it before these things come up is the important part, because sometimes it can really catch you off guard when they say something and it may be something in their day that spurred something. Maybe it's one of my issues with metastatic spread and going through treatment again, or her being like, oh, I just, what can I do to avoid having to go through this journey without her thinking about it all the time and helping her navigate that. So hopefully that's helpful, Sherry, or anybody else who was concerned about having BRCA in their family.
Thank you for touching on that. That you basically summed up the question. If anyone hasn't seen the question in the chat, it's just talking about BRCA and the risks to kids and how to talk to them about that. Before we move on, Di, was there any hospital staff in your experience that was helpful in preparing for conversations with your kids about genetics? For instance, like a social worker or a genetic counselor? Or anything you would suggest?
It's evolving. I would say in the beginning, 10 years ago, genetics, they tested for 4 genes. I just recently been tested for 20. And I will have, when my daughters are old enough, I'll have them tested. So it's advancing very quickly. I know that there's a lot of research being done on this. As far as having medical staff supporting it, unfortunately, I find with all things related breast cancer, you have to be a huge advocate. If it is something on your mind, you have to ask questions. You have to get people motivated to help you and explain things to you. It's just the way the health system works. And you can do it in a very nice way, but nobody came to me saying, do you want to be tested for BRCA? I had to say, I have had family history. I need to get this tested. I was concerned about my daughters. And then I wanted to dive more into the information about genetic testing and where it's going. So again, being an advocate, being curious, being knowledgeable, it all comes back to having the information is power, like Kara said.
That's great. And everyone, as we continue to talk, feel free to keep an eye on the chat, because I know the Pickles Group and also other attendees have some great insight as well to some of these comments. Marquita, you can please share.
Okay. So I was going to answer the question, what has been challenging, and I think I would say it's difficult balancing being honest and also instilling a sense of hope, because just like with your kids, you always kind of want to tell them that everything will work out for the best. But with the breast cancer diagnosis, there's the fear of unknown, which makes it impossible to tell them that. So I find that one of the most challenging things is trying to balance the perfect way to be honest, and let them know the serious of the situation, but also give them hope.
Sure. And that sense of perfection is probably, we have to
Yes.
kind of get rid of that word too, right? Because it's
Yeah.
never going to be perfect. It's always hard, right? And so,
Right.
but of course, as parents, we want that. And I think that's common. Yeah.
Yeah.
I can jump in too. And Marquita, I think you raised some really good points there. So I guess I would say one of the things that I thought was the most challenging is that your kids don't react in the way that you want them to react. And I think we sort of have an idea of we're going to tell our kids about something that's going on with breast cancer, and we have this vision of how they're going to react. And it's usually not, it doesn't go that way. And at least for me, like my two kids are night and day, and they both reacted really differently. I mean, my son was really compassionate, really cuddly, just really understanding. And then my daughter kind of had the attitude of cancer doesn't exist, you're fine. And there were a lot of times where that really hurt my feelings. But at the same time, like, they're teenagers. They're supposed to think that they're the middle of their universe and things revolve around them. So I kind of have to keep reminding myself about that. And then especially with my daughter, one of her best friends had lost her mom to breast cancer very recently. And her journey was very similar to my journey. But, obviously it had very different results at the end. But, she went through a lot of the same things along the journey that I went through. So, my daughter was very scared, but she chose to react in the, you're fine, everything's going to be fine, and not really listening to what I was going through. So I guess just my takeaway there is your family members might not react how you would like them to react, but it doesn't necessarily mean that they love you any less.
It's a good reminder. It's hard to adapt to each kid and just their differences. Yeah. What information or resources within the healthcare system or just in general did you guys all find the most helpful to you in terms of parenting and conversations with kids?
I can answer that. So I promise you that Sharsheret is not paying me to be here, but I really got so much from Sharsheret. I'm part of the UCLA health system, and there's lots of resources that UCLA has, but you really have to look for them, and they're not necessarily provided at the time when you might need them. I don't know if other people have found that too. So, for example, like they offered me a nurse navigator and they offered me some other things, but it was right at the point where I was diagnosed and I just had my mind in so many other places that it wasn't really helpful to me at the time. But Sharsheret was really good because, first of all, I had a social worker that was there and available every single time I needed to talk to somebody and get through this hard emotional journey. But at the same time, they were reaching out to me at appropriate times. So when I was going through chemo, that's when all the chemo resources were made available. And when I was going through radiation, that's when all the radiation resources were made available. So, you know, it can just be very overwhelming when you have a diagnosis and you know that you're going to have to go through a lot of different steps. So, you know, to me, I really just can't say enough about all of the emotional support that Sharsheret was able to give to me.
Thank you. I appreciate that. Like you all are saying, you guys were diagnosed at different times, different years, and different resources were available at those times. And so I know all of you have differing experiences with that. But other resources or information that other people found helpful, whether it be at your healthcare system or otherwise?
Our oncologist was amazing. As you're saying, everyone was diagnosed at different times. And when Mike was diagnosed, especially, there was so little about men with breast cancer. You know, there were really no resources. And I don't know. I didn't really find anything out there when I was looking. I don't know. Maybe I didn't really know anyone going through what we were going through at our age. But our oncologist was fabulous, and she helped us, and she helped us in talking to the kids, and our rabbi was terrific as well. That's kind of where those are the people who helped us the most in how to talk to our kids. And I said to the kid, you know, at any point I would have found someone for them to talk to if I thought it would be helpful as well.
Sure. Thank you. We have about 1 minute left for the panel discussion. So any lasting advice that you all haven't already shared that you want to share to other parents on this call? Di?
I would just like to say that, you know, the overwhelming thing that I've heard from all the panelists tonight, which is everybody's been so helpful, and even with being a parent with cancer, hearing from your experiences as well. But I think one of the most important things that we've touched on is to have a community outside your healthcare system, wherever you find that. And I think that that's the beautiful thing about Pickles, is it's here for you, and it is here to help you get through parenting with having cancer in your family, whether it's yourself or you're the caregiver or what the kids needs. It is so important to have that support, because unfortunately our healthcare systems can't provide everything. And having that support system, whether you find it through another local breast cancer organization or what you need for yourself, having now something like Pickles to help us navigate is just so important to make sure that you feel strong and supported, and you have the right tools in your toolbox to get through this as a parent.
That's great. And so peer support is another kind of option too to consider that aligns with what you're saying. And some hospital systems have their own. We have our own at the James, but also there's national organizations that have peer support. And you can say, like, I really want to be connected with another parent that's dealing with parent conversations, and see if they're able to accommodate that. So keep that in mind. Anyone else before I turn it over? Kara?
I was just going to say, I think the two most important things that you can do in a situation is try to keep things as normal as possible for your children. And it's so hard, but it's really important for them. And the other thing is whether you're good at it or not, accept help from people around you, from organizations, from friends, wherever you can get it, because you need it.
Mm-hmm.
Thank you.
Yeah. Thank you, Kara.
I just had one quick thing. I wanted to just piggyback on what Diana was saying about the community. You know, your family just, they always want to be there for you, but like I was saying earlier, they just might not react or know how to react. So find somebody to talk to, and it can be a friend, or it can be a social worker, or just anyone that you feel comfortable just really talking to. And even if that means like venting about your own family, you know, it's such a difficult emotional journey, and So I just would encourage everybody to have that, those one or two people that they can talk to.
Thank you, Karen. And thank you, all of you, again, for sharing, and for everyone in the chat that's been sharing about their own experiences too. It's nice to have a space where you feel like you can be vulnerable and share with each other. So I'll hand it back over to you, Kelsey.
All right. Thank you. Thank you so much to our incredible panelists and Lauren for moderating the discussion. There is a lot of rich information in the chat as well, so make sure that you get a chance to look at that. I was also trying to kind of add some of the ways that we approach some of the discussions that were being had. And I think the discussion about genetics was a great example just in terms of being able to apply some of the tips that I shared earlier about sharing information, expectations, and feelings, and really, giving kids choices and empowering them. But that can be a hopeful conversation in some ways because it can talk about prevention and the expansion of medical care. And Marquita, I love what you shared about hope because one of our teen peer leaders gave the most beautiful speech about how hope changed for him. It was never lost hope. He was talking about how important hope was, but how it shifts and changes throughout a cancer experience. And it was really remarkable to hear that directly from a teenager. So just really value all of your personal stories. I do want to just highlight what we have coming up here at Pickles Group, specifically for the peer-to-peer support and connection. We do a 5-week Connect Over Cancer program every season for kids all over the map. So this is a national virtual program. It is free, and we are currently enrolling for our winter cohort. So the dates are on the screen. It starts January 12th, and registration is due by December 20th. So if your family or a family you know or you work with is interested, we'd love to welcome you. We also have a couple in-person events coming up, including this Sunday in the Chicagoland area. But for the first time ever, we're also doing an in-person event in Columbus, Ohio. And so I'm really grateful to partner to have Ohio State here today. But also, if you're a family in the area, we'd love to have you because we really just value the reach, finding your community and recognizing that your community can be found in a lot of different places. And sometimes it may just be, when it's being offered or when you find it. And so we just want to make sure you're aware of all that's available to you. And then I'm gonna pass it over to each organization to share a little bit more about what you have going on. And I'll also add that for those of you who maybe are feeling like, oh, this information would actually be really helpful to my family or my friends who maybe aren't handling these conversations in the way that I would like or hope, you can share one of our family cancer support kits with anyone. Anyone can request it. Anyone can watch this recording. We welcome anyone to these How to Talk to Kids About Cancer discussions. And so if that would be helpful to share these resources with your loved ones to help them help you, we of course encourage that as well. And then just stay involved and we'll make sure you get the support kits and get some follow-up information in an email. I'm going to turn it over to Amy to talk a little bit more about Sharsheret.
Hi, thanks so much for having us. This has been great. And Karen, you made me laugh out loud when you said we did not pay you for this. So thank you, Karen, also for your sweet comments. So yes, Sharsheret has a team of social workers and genetic counselors here to help anyone facing breast cancer, ovarian cancer, and also the genetic predispositions towards them. If anybody is diagnosed with a BRCA mutation or any other type of mutation, whether they have a cancer diagnosis or not, is what that refers to. So I had a lot of ideas for the questions and the conversation around the BRCA mutation. So if anybody is looking for support around talking to their kids about genetics or high risk, that is what we do. It's really a big part of our specialty. And we have 2 genetic counselors and a team of social workers with a lot to share about that. So, what we do is really personalized to each person who calls us. And though we do focus on breast cancer, ovarian cancer, and genetics, you can call us with a different type of cancer and we're not going to turn anyone away. But we send care packages, some of which are on the screen. I think for this webinar, I really want to highlight our Busy Box, which is toys and resources based on each child's ages and interests. So we actually ask, what is your kid like playing with? Let's start with the 6-year-old, now the 4-year-old, and really talking about what kind of toys they like so that we can send them something they'll like. It also comes with a storybook that explains cancer on a child's level and resources for the parents. Karen mentioned our financial subsidies. We also have lots of other kits and resources available, not just for the person with diagnosis, but also anyone who is their caregiver. And we use that term very loosely. So it doesn't have to be a spouse or someone in the home. Anyone who cares about someone with a diagnosis, we are here for them. And I also see a typo there, so I'm gonna put my email in the chat so everybody can reach out to me, and it'll be spelled correctly in the follow-up email, I promise. Thanks so much again for including us.
Thanks, Amy. All right, I'm going to turn it back over to Marquita with Keep Abreast. Wearing multiple hats today. Thanks, Marquita.
Yes. So I'm the Give Back Grant Program Manager for Keep Abreast. And what I would like to highlight today is our Give Back Grant Program, which is a program that's our goal is to provide financial support to women of color impacted by breast cancer. So just understanding the very unique challenges that Black women and women of color face when dealing with breast cancer, we would like to offer them support. And our grant cycle opens, it starts November 11th. And it's a great grant because you're able to, unlike other grants, you're able to pretty much use it as you need. So if it's for a copay, if it's for transportation or whatever, we just want to acknowledge those that are that have been impacted by breast cancer. We understand that although surviving breast cancer is always it's a victory, but we know that there's still challenges that women face, and so our goal is to provide that support and also to just let them know that we see you and we care.
Thank you so much, Marquita. I do want to just also lift up that we have in June, in honor of Juneteenth, we did host a Centering the Experience of Black Families webinar and panel. So that's also available on our YouTube channel for families or clinicians who are looking for that content as well. All right, Sherry, I'm going to turn it over to you for Male Breast Cancer Global Alliance.
Thank you, Kelsey, and thanks for having us. As Kelsey said, I am the founder and president of the Male Breast Cancer Global Alliance. We have been supporting men diagnosed with this disease for well over a decade now. We advocate on their behalf with state and federal government. We even get involved in European government if need be. I have worked with Medicaid to get rulings that men have been denied coverage for overturned. We will stop at nothing to make sure that these men are included in clinical trials and research, and that their names are included on the packaging of these breast cancer drugs. So we work with pharmaceutical companies as well. And the biggest part of what we do is to educate people. And we do that through what we like to call our journeys. Anybody going to our website will find that the men that come forward to tell their stories, and those stories resonate with someone else coming to the page. So we partner with Pickles, and they are not yet up on our website, but they are going to be one of our support resources, because honestly, I had a man call me about a year ago, November, and said that he was about 53 years old, and him and his wife were struggling with how to tell their children that daddy had breast cancer. And that's when I found Pickles. So I needed that support, and I appreciate you guys for being there.
Thank you so much. And last but not least, Lauren, can you tell us a little bit more about the James Family and Parenting Programs?
Yes, so again, the James is located in Columbus, Ohio, but we have a large amount of services that are actually open to anyone, no matter where you receive treatment at, and some of them are virtual and accessible for folks that don't live in the area. So Parenting Through Cancer is what I manage. It's primarily webinars, educational and supportive webinars, along with a monthly parenting support group that is virtual, support and resources online. And also you can call and just talk to me with your questions that have to do specific to your kids and their needs. And we also have some on-demand videos related to parenting and some past lectures about these conversations with kids. Similarly, we have Families, Teens, and Children program that basically are programs for the whole family to attend together, or a parent and child to attend together, to learn about cancer and healthy coping skills and healthy lifestyle choices. And so those are just a few of our examples of our programs. All of this is free of charge and open to the public. And again, a lot of it is virtual. Some of the family programs are in person. Our child life services at the James, that is James specific. So for any folks that are James patients, we have child life services that would just be a referral from your doctor, but is a no cost to the patient and family. And they work with the patient with kids under 18 to talk about normalizing the medical setting and the cancer experience, how to talk to your kids about cancer, language. They can talk about how to talk to your kids about a port or about surgery. So kind of all of the above, but it's more individualized support. And so that could be them working with just the parent, just the caregiver, just the child, or together. So very customized to the family's need. And then of course we have a playroom for James patients only, but that is available. So it's a great space that we have at the hospital for kids when they come visit and need a neutral setting to meet with or to visit with their loved one. So at the bottom is our website for our parenting page. And I am sending some attachments for Kelsey to share too, because we do have James Care for Life is basically the umbrella that we're under. And James Care for Life provides free and supportive programs for cancer survivors and caregivers, all different cancer types, and free of charge, some virtual programs, some in person, open to everybody, no matter where you get treatment at. So that's a great resource just for supporting yourselves through everything, right? And so all of our programs advocate for just holistic wellness in different capacities. So I'll share that with Kelsey, and you can kind of see all the different programs that you're able to register for, even virtually. So that's a quick overview. Thank you.
Amazing. Thank you, Lauren. And thank you, everybody, for sticking with us. I know we're a few minutes over, but you will get a copy of the PDF, the attachments, the links, the emails. So everything that you need to stay engaged with all of us will be in the follow-up email, including a recording if there's any of this that you missed or you're joining us later. So I'll let you all get back to your lives and your families and yourselves. But thank you so much to our incredible partners and panelists, and for all of you for showing up to help the kids in a parent with cancer's life. So thank you and have a great evening.